Terbutaline is a beta-2 adrenergic agonist used as a bronchodilator and to prevent premature labor. In this video, let's found. What is terbutaline? What is terbutaline used for? Contraindication. What are the side effects of taking terbutaline? How does terbutaline work? How to use terbutaline? What is terbutaline? Terbutaline, sold under the brand names Bricanyl and Marex among others, is a beta-2 adrenergic receptor agonist, used as a reliever inhaler in the management of asthma symptoms and as a tocolytic to delay preterm labor for up to 48 hours. It was patented in 1966 and came into medical use in 1970. It is on the World Health Organization's list of essential medicines. What is terbutaline used for? Terbutaline is indicated for prevention and reversal of bronchospasm in patients at least 12 years old, with asthma and reversible bronchospasm associated with bronchitis and emphysema. Contraindication. Hypersensitivity to sympathomimetics. Use over 72 hours in management or prevention of preterm labor. Oral administration in preterm labor. Side effects. Adult, tachycardia, anxiety, nervousness, tremors, headache, hyperglycemia, hypokalemia, hypotension, and, rarely, pulmonary edema. Fetal, tachycardia and hypoglycemia. Pharmacodynamic. Terbutaline is a beta-2 adrenergic receptor agonist indicated to treat reversibly bronchospasm in asthmatic patients with bronchitis and emphysema. It has a short duration as the inhaled form is taken up to 3 times daily, and the therapeutic window is wide. Mechanism of action. Terbutaline is a selective beta-2 adrenergic receptor agonist. Agonism of these receptors in bronchioles activates adenylyl cyclase, increasing intracellular cyclic adenosine monophosphate, CAMP. Increased CAMP decreases intracellular calcium, activating protein kinase A, inactivating myosin light chain kinase, activating myosin light chain phosphatase, and finally relaxing smooth muscle in the bronchiole. Half-life. An oral dose of terbutaline has an elimination half-life of 3.4 hours, while a subcutaneous dose has an elimination half-life of 2.9 hours. Dose. Orally. Initiate at 2.5 mg 3/4 times daily orally. Maintenance, 5 mg 3 times daily orally every 6 hours while patient is awake, reduce dose to 2.5 mg every 6 hours. Not to exceed mg per day. Subcutaneous. 0.25 mg every 15 to 30 minutes x 3 doses as need in lateral deltoid. Not to exceed 0.5 mg per 4 hours. Pediatric dosage. Orally. Children than 12 years of age, 0.05 mg per kilogram 3 times daily initially, increase as needed, not to exceed 5 mg per day. Children 12 to 15 years of age, 2.5 mg orally every 6 hours 3 times daily, not to exceed 7.5 mg per day. Children older than 15 years, 5 mg per dose orally every 8 hours 3 times daily, reduce dose to 2.5 mg every 6 hours, not to exceed 15 mg per 24 hours. Subcutaneous. Children younger than 12 years of age, 0.005-0.01 mg/kg, no more than 0.4 mg, every 15 to 20 minutes for 3 doses, then every 2 to 6 hours as needed. Children older than 12 years, 0.25 mg every 15 to 30 minutes x 3 doses as needed in lateral deltoid, not to exceed 0.5 mg per 4 hours. Safety advice. U.S. FDA Pregnancy Category C, animal reproduction studies have shown an adverse effect on the fetus and there are no adequate and well-controlled studies in humans, but potential benefits may warrant use of the drug in pregnant women despite potential risks. That's all the information about terbutaline we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.